Well, hey, Anatomy, hope you're doing well. You watch this video. We're wrapping up school here amidst a pandemic at home, but we got a few more weeks left. And so this is video number 2 on the heart cardiovascular system. We'll walk you through a couple of objectives today and hopefully help you learn about the heart, the pump that keeps you going and learning and watching YouTube videos. So anyways, again, hope you're doing well. Let's get started. So the first objective I want to talk to you about is the structure of the pericardium and its functions, and also the layers of the heart wall and cardiac muscle. So here is the walls of the heart consist of 3 layers. Okay, you have the epicardium, which is the outside, epi, myo meaning muscle, so here's your cardiac muscle cells, and then endocardium, which is the internal, endo, inside, internal situation. Here's the pericardium. Pericardium is the covering of the heart. So you have your parietal layer, which is, on the outside, serous pericardium, and then visceral layer, which means it's directly on the heart. And then you have this fluid right here that is inside the pericardial cavity. And then so that is the organization of the heart's coverings and also the heart's layers. Sometimes there can be an infection of one of the heart's layers called endocarditis. It's an infection of the inner lining. Sometimes it happens when bacteria or other germs from your body, mouth, spread through your bloodstream. Again, this is pretty rare, but it can happen and attach to damaged areas in your heart. Again, the key word is damage there. And so it can really hurt valves and various things. Here's a picture of it from a cadaver. You can see here that all those lesions, vegetations right there, massive platelets and fibrin, microcolonies of microorganisms that can really damage and scar heart tissue and valves. So cardiac muscle and skeletal muscle are different. We learned about muscle, very long time ago, but cardiac muscle, you can see here, there's these intercalated discs underneath the microscope, this light microscope, sorry, 575 times magnification. So you can see these branching interconnections between the cells. Why? Because the heart has its own electrical system and it needs to beat together. If you ever felt your heart quiver or anything like that, or have skip beats, you understand how important those rhythmic contractions are. So cardiac muscle is, of course, only in the heart. It's striated, which means there's myofibrils in it, and it's almost totally dependent on aerobic metabolism for energy. So you need oxygen. We're going to see here in a little bit when the heart's deprived of oxygen what happens. These intercalated discs, again, attached. How are they attached? They're attached by desmosomes and gap junctions. These plasma membranes are attached by that. So gap junctions allow action potentials to spread. So action potentials, again, these rush of ions, right, causing cells to contract, muscle cells to contract, sarcomeres, if you want to be technical with it, allows all interconnected cells to function together as a single unit. Okay, so that is the importance of desmosomes and gap junctions. So questions part 1. From superficial to deep, I want you to name the layers of the heart wall. Again, you can email me these answers. Number 2, why is it important that cardiac tissue contain many mitochondria and capillaries? Number 3, what is ARVD? I want you to research that and tell me, how do gap junctions relate to that disease? Again, sometimes diseases happen because these gap junctions and desmosomes aren't genetically formed correctly. And then what are the risk factors for developing endocarditis? Look up those answers for questions part 1. In part 2, we're going to talk about the cardiac chambers and the heart's external anatomy. So basically the heart is a pump that has 2 sides. So basically 2 pumps in one machine. The right side deals with deoxygenated blood and pumps to the lungs. The left side of the body deals with oxygen-rich blood and pumps to the body, or called the systemic circuit. So there's 2 upper chambers called atria. They're receiving chambers. They receive blood. And then there's 2 lower chambers called ventricles, and these are discharging chambers or pumping chambers that pump blood to the body. So you can see a picture here. Again, knowing these pictures or where they are is very important. But you can see there's an auricle, kind of like a fold, and then the right atrium. And here's the auricle of the left atrium and the left ventricle, which is the most muscular part of the heart, and the right ventricle right there. Those are the 4 chambers of the heart. So here's a heart from a cadaver, a deceased human being. And so you can see here that there's the right atrium and the right ventricle, left atrium. You can see almost an exact, the picture, the drawing, and the picture, the real picture is almost exactly the same. So that's pretty cool. Knowing all these terminologies, these terms is important. down the road if you're interested in medicine or nursing. But right now, just knowing kind of what I talk about is sufficient. So here's the heart kind of cut with a frontal cut. And you can see here that blue is usually colored in diagrams to indicate deoxygenated blood, and red is oxygenated blood. And so you can have the aorta and the superior and inferior vena cava. And then you can have the right side of the heart. So here's the right atrium and the right ventricle. And then you have the left atrium and the left ventricle right there. And all this is muscle. And you can see that that's kind of how the heart looks. So questions part 2. I want you to contrast, really easy question here, contrast the atria and the ventricle. So moving on, if you were to see this picture, you might not be sure of what it is, or you might know what it is. But this, my mom actually had to undergo one of these catheterization, heart catheterization, which basically they cut a very large vein in your leg. I'm forgetting exactly which vein that is right now, inner leg. And then they insert a wire with a catheter up your body and into your heart. And what they do is they inject dye inside the heart to check out the arteries of the heart. And what you see here is a very big difference. This is a before and after. So let me see if I can write. This is a before and this is an after. And what happened was, you see that? That's death waiting to happen. That's what that is. That's a blockage. And so what they did was that they opened that blockage, and you can see the difference, right? There's a whole like branch of arteries not getting supplied with oxygen. So this person had abnormal EKG, may have suffered a heart attack, may have been suffering from chest pain or something like that. But what this cardiologist literally did was save this person's life. This blockage would have ended in death. They go in, they remove the blockage by a couple of different ways I'll talk about here in a second. They opened it up, and therefore that muscle, the heart muscle that was being deprived of oxygen, is no longer being deprived of oxygen. Saving someone's life, not a bad day at work. So here's the objective for part 3. I want you to describe the major vessels. So the heart's a muscle, so it needs oxygen, it needs nutrients. And so it has its own circulation, and it's called coronary circulation. So blood in the heart chambers does not nourish the myocardium. The heart has its own nourishing circulatory system. So its own nourishing, it's called coronary circulation, and it's involved arteries, which is again oxygen-rich blood, veins, which is deoxygenated blood in the veins, and then blood empties into the right atrium via the coronary sinus. So again, coronary sinus brings that blood back to the heart. So it has its own circulatory system, which is pretty awesome. So coronary circulation continuously supplies cardiac muscle with oxygen and nutrients. So you can see here, there's the left and right coronary arteries. And so you can see this is the posterior view of the heart. And you can see that the heart right here, the left side, left coronary artery, right coronary artery. And you can see, and I'm sorry, this is not a posterior view, this is an anterior view. They just removed the pulmonary trunk right there for you to see that. But here is the anterior view of the heart, and so this is the left coronary artery right here, and the right coronary artery, and that is filling. It fills up with blood when the ventricles are relaxed. So myocardial blood flow may increase to 9 times the resting level during maximal exertion. So the heart really needs oxygen and nutrients. Here is the posterior view. I apologize about that. This is again the circumflex artery, circumnavigate around the world, so it's going around the heart, and all of these arteries are bringing oxygen-rich blood, many capillaries, to the heart. The heart needs this oxygen and nutrients. And then the veins, of course, are bringing the oxygen back. So what could possibly happen if there's a blockage? Well, a term all too familiar in today's society, heart attack, can happen. So when a blockage of blood blocks, it's blocked by plaque, blood flow is blocked, you could possibly, or someone that you know could possibly suffer a heart attack. And so I do want to talk to you about the symptoms, because if you're around someone that's having a heart attack, 911, knowing what to do could save someone's life. And so literally it's like a burning or a clenched fist in the chest, feeling like someone's squeezing the chest or sitting on the chest like an elephant on the chest. Indigestion sometimes, vomiting, dizziness, fatigue, lightheadedness, cold sweat, sweating, clammy skin, Pain can occur. Sometimes it doesn't even occur. Sometimes they're silent, which is crazy to think about. Discomfort or tightness, arm discomfort or tightness, anxiety, feeling of impending doom. I mean, as you can see here, I've dealt with anxiety a lot. These are all symptoms of a panic attack. So you can see why panic and anxiety is such a trial for people who undergo it mentally. But yeah, heart attacks don't, play around, of course. 911, stay with them until help arrives. So here's what a blockage looks like. And this is plaque. So sometimes that plaque can break off, and what the blood's, when blood sees a clot can form because blood clots when there's a breakage. And so sometimes we want our blood to stop bleeding out of us, but if there's a clot inside of us, that's an issue, of course. And so this blockage right here is preventing these heart cells right here, cardiac cells, from getting oxygen and nutrients, and they are dying or dead. And so this part of the heart does not function correctly. And so it can lead to arrhythmias or fibrillation and possible sudden death or a heart attack. Here's some more signs and symptoms of a heart attack: tightness and pain, left arm pain, sometimes shoulder pain, jaw pain. It's really tragic, of course. So questions part 3. What are the risk factors and lifestyle factors that increases someone's chances of having a heart attack? So I want you to look those up. What are the risk factors and lifestyle factors? And some of y'all might be tempted just to eat poorly, but actually look it up. Like, what do these health organizations say? What are the current recommendations given by these health organizations that you look up to lower one's chances of having a heart attack? That's questions part 3. So what did they do in that cath lab? My mom went in, she didn't have any plaque or anything, everything looked fine. The EKG reading was just abnormal for some reason else, but you can see here what they did was sometimes they go in with a catheter and they find a blockage, and literally they expand a balloon. I believe it's called angioplasty. And literally here's the plaque, and they push that plaque again out of the way. And so now increased blood flow is the goal, which is awesome to think about. But I'm sure you've heard of someone having a bypass. Well, what's a bypass? Well, here's a bypass. So a single bypass, a double bypass. What you're literally doing, like if there's a blockage on the road and you bypass or go around a detour, you're taking blood to the heart muscles that are dying around the blockage. Okay, so this is what I mean: triple, quadruple bypass. So literally a quadruple bypass, which I've heard of a couple of people in my life getting them, and I'm just like blown away. But that means there's 4 blockages. Again, they're living, which is a miracle, and thankful to God that they were. But 4 blockages, and they're bypassed it 4 times. 4 blockages. And here's closing up. Here's the veins that return blood to the heart. The most important one to understand, of course, is the coronary sinus, which returns blood back to the heart. So blood flow through the coronary circuit, what is it driven by? It's maintained by blood pressure and elastic rebound. These are 2 terms that I would like for you to know about, okay? So left ventricular contraction, the strongest part of the heart, pumping to the body, forces blood into the aorta, that huge like shepherd hook, that largest artery in your body, going to take oxygen-rich blood everywhere in your body, elevating blood pressure there. The left ventricular relaxation, right? So it pumps and then relaxes. Pressure decreases and aortic walls recoil, and that's called the elastic rebound. So it pushes blood in both directions, forward into systemic circuit and backward into coronary arteries, and this is how the heart gets its oxygen. The objectives in the next part of this video, which we're wrapping up here in a little bit, I want you to be able to trace blood flow through the heart, identifying the major blood vessels, chambers, and heart valves. I want you to also describe the relationship between the AV, atrioventricular valves, and semilunar valves during a heartbeat. So, heart valves, you have 4 of them. Atrioventricular valves are between the atria and the ventricles. Name makes sense, right? The bicuspid's on the left, and the tricuspid is on the right. So you need to know where those are for test questions. Semilunar valves are between the ventricles and arteries. So there's the pulmonary semilunar valve, which is between the right ventricle and the pulmonary trunk. And then you have the aortic semilunar valve, which is between the left ventricle and the aorta. You need to know where these valves are located and what which organs, parts of the heart they're between. And so here's a good picture here from Pearson. So you can see here that you can have the right atrium, okay, right ventricle. So there's that tricuspid valve. And then here is the other valve, the pulmonary valve between the right ventricle and the pulmonary trunk, which is sending blood to the lungs to get oxygen. The blood returns via the left and right pulmonary veins, the only veins that are carrying oxygen-rich blood in the body. And then you have the left atrium. The blood goes through the bicuspid or mitral valve or bicuspid valve. I'm actually going to ask you a question about the mitral valve here in a little bit. And then it goes into the left ventricle through the aortic valve into the aorta to go to the body to keep you running and watching YouTube videos and, watching Netflix for like 6 hours a day. I don't know what you do, but it's that's on you. All right, so comparison between the chambers. Atria have smaller workloads, of course. They're receiving chambers. Ventricles have very different workloads. The right ventricle has a thinner wall because it doesn't work as hard. The left ventricle is literally the largest part of your heart. Why? Because it has to be the strongest wall of that muscle to pump blood to the entire body. It creates about 4 to 6 times the pressure of the right ventricle, which is crazy to think about. Contraction actually decreases the diameter. This is how powerful it is. It actually changes the shape of the heart. It decreases diameter and apex to base distance, and it actually even squeezes into the right ventricular space. So when it pumps, it extends even into the right ventricular space. Let me show you a picture here of what that looks like. So you can see here's the heart cut into, this is a transverse cut. So you can see that the thin wall of the left ventricle and the thin wall of the right ventricle, but you can see all of that muscle in the left ventricle. And when it pumps, you can see dilated, relaxed, contracted, pump. You can see how it pushes into the volume space of the right ventricle. So your left side of your heart is the strongest. So the last couple things that we're going to talk about in this video is blood flow. Right side of the heart, deoxygenated blood. Left side of the heart, oxygen-rich blood. Right side deals with lungs. Left side deals with the body. So right side is called pulmonary. Left side, pulmonary circuit or circulation. Left side is called systemic circulation. So when ventricles are relaxed, they fill. So what's open when the ventricles are filling? Well, the atrioventricular valves are open because blood's going from the atria into the ventricles. Semilunar valves are closed, of course. So blood pressure from pulmonary and systemic circuits keep them closed. When the ventricles contract, very powerful contractions, pressure from contracting ventricle pushes cups together. So papillary muscles tighten these tendons here called chordae tendini. So cups can't invert into atrium, prevents backflow, regurgitation. When the doctor is listening to your heart, he's just listening, puts a stethoscope right there. He's like listening, lub-dub, right? Lub-dub. He's listening for regurgitation. He's listening for like a swooshing sound or all these different sounds that he teach him in medical school. Because what he could possibly tell is if you're having heart valve issues or if your heart's strong. That's the first step in diagnosing heart problems, just listening to the heart, and they're trained to do that. So semilunar valves open, and ventricular pressure overcomes pressure in the pulmonary trunk and aorta that held them shut because, of course, that is an extremely powerful contraction. So these are the semilunar valves. You can see that they have 3 half-moon shaped cusps, and it prevents backflow of blood from the aorta and pulmonary trunks. There's always a little bit of backflow, but if you ever have an echocardiogram when they do like the ultrasound of your heart, they'll measure all of this. But that is, but you don't want much regurgitation, of course. And actually, that's going to be a question coming up that I'm going to ask you. Valvular disease, valve function deteriorates until heart cannot maintain adequate blood flow. So sometimes it's congenital, which means you're born with it, or sometimes it's from heart inflammation, whether it be due to a sickness or drug use, or severe cases. Actually, you have to go with a fake valve, and so that's what it kind of looks like right there, bioprosthetic valve. Just think about that surgery for a second. You're replacing a heart valve. So your heart sounds like lub-dub, lub-dub, lub-dub. Or if you're out of shape, lub-dub, 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 lub-dub. Or if you're working out, lub-dub, lub-dub, of course. And so 1 cardiac cycle, 2 heart sounds. Lub-dub. When the ventricles contract, lub. When the atria contract, dub. Lub-dub, lub-dub, lub-dub. That's how it literally sounds. Diastole is relaxation. Systole is contraction. And usually they're talking about the ventricles when they use those terminologies. So you can pause this picture. I'm not really going to go over it too much, but the atria contract, and then Systole, the ventricles contract. You can see that there's a pause, right? And then you can see what the AV valves and semilunar valves are doing. So let's do this one more time. The right atria receives deoxygenated blood from the inferior and superior vena cava. Right atrium goes to the tricuspid valve. Blood goes from the right atrium through the tricuspid valve into the right ventricle, through the pulmonary valve to the lungs. Blood gets oxygen in the lungs, returns through the pulmonary veins, left and right, into the left atrium, goes through the mitral valve or the bicuspid valve into the left ventricle, and then pumps, very forceful contraction, pumps through the aortic semilunar valve, through the aorta, and to the rest of the body. And here's a nice picture here describing all of that. You can see that the heart has its two pumps. Right side deals with deoxygenated blood, left side deals with oxygenated blood. Systemic circulation, left side, pulmonary circulation, right side. So this is the last part of your questions for part 2 of the cardiovascular system. If you watch this long, I appreciate you. You are awesome. You are rocking it, and we're finishing on a high note. Questions part 4. What is mitral valve prolapse? I actually have a family member who has this. I want you to look it up. What is mitral valve prolapse? Number 2. Define cardiac regurgitation. Just define it. Is it dangerous, and how is it diagnosed? And then part 3, which I literally just did for you. Starting with the right atrium, trace the path of blood to the aorta, including the valves. I hope this video was helpful. I hope y'all are doing well. God bless.